parasites, those kind of things. We want to check for neurotransmitters. Neurotransmitters are the chemicals that communicate between the nerve cells in your brain and in your nerves. They're actually sending the signals from and to your brain. If you're deficient in these neurotransmitters, or if something's not working quite right with them, then your signals aren't being sent, or they're not being received, one way or the other. We have to check that. We have to make sure that that's not an issue. We might want to check your hormone levels. Okay, that's important. We might want to look for inflammation. C-reactive protein and homocysteine levels will tell us if you have inflammation inside of you or not. If there is inflammation, and for other things, we use something called glutathione. Glutathione is the mother of all antioxidants, and it works fantastic in clearing up inflammation, ridding your body of free radicals, which are really detrimental to the body. They cause incredible amounts of nerve damage. So glutathione is very effective that way. Once we've determined your specific metabolic condition, or the component of your metabolic component, we can use diet and nutrition. We can use supplements to help the body right itself. We won't be using chemicals to confuse or conflict with the body's natural processes. We use good things to assist in those processes until your body starts working correctly. So that's the right hand of things. That's how we treat you metabolically. Let's look at the left hand now, how we treat you and how we look at you neurologically. Now, neurological treatments are going to be based on specific neurological testing. We'll take you in our office, we'll do certain tests that will tell you what part of your nerves, or what part of your spinal cord, what part of your brainstem, or your brain itself is not functioning properly. Let me tell you a little bit about your brain and your nerves. Your brain needs two things to be able to survive and to function properly. Those two things are fuel and activation. Fuel comes to us in the form of oxygen and glucose. We covered the glucose side of things when we talked about metabolism. Let's talk about oxygen for just a second. Oxygen is critical to the brain. As we age, we lose our ability to utilize oxygen about 1% per year after the age of 25. That's through a process of oxidative phosphorylation. So, for example, a 50-year-old person has lost 25% of their capacity to utilize the oxygen that they breathe in. Now, your brain uses 20 to 30% of the oxygen you breathe in. So when I take a breath, 20 to 30% of that oxygen goes straight to my brain. So it's very, very important for the brain to survive. And if we're losing 1% per year after the age of 25, you can see how quickly the brain can become oxygen deprived and oxygen starved. And without oxygen, our nerves can't survive. So oxygen is critical. We use exercise with oxygen therapy to help deliver oxygen to the brain. We might put you on a treadmill to walk, or we might put you on an upper body cycle where we have you cycle with your hands like this to help increase the heart rate, to deliver that oxygen straight to your brain much more effectively. And it works fantastic. We use certain brain-based therapies, certain therapies like vibration. Vibration therapy is going to stimulate the back part of your spinal cord called the dorsal columns. It stimulates it up into the cerebellum, the back part of your brain here, and up into the brain itself to help increase the firing, to help the brain restore those pathways that may have been lost. We might use laser therapy. Laser therapy activates your cells. It activates specifically the mitochondria found inside your cells. Mitochondria make energy in your cells. So if we stimulate those mitochondria, it's going to help make more energy. It's going to help your cells heal themselves much, much quicker. It works fantastic. We might use decompression, non-surgical spinal decompression. This is a low back and a peripheral neuropathy benefits. Okay, it's going to work the back, help relieve pressure off the spinal cord. It's going to help with the legs and feet as well to stimulate the spinal cord up into the brain. We might use something called the ATM. Now, I wish it was giving me money, but it's not. It stands for Alternative Therapeutic Movement. This little contraption helps us restore the lost or malfunctioning neuronal pathways that the body needs to communicate with the brain, or the brain needs to communicate with the body. So once we've tested to determine your specific neurological condition, we can treat it using those things I just mentioned. So I want you to ask yourself this: how has your neuropathy affected your job or your relationships? How has it affected your finances or your family or other activities? What are you doing, what are you not doing right now that you would rather be doing if you did not have this neuropathy? How is it affecting your lifestyle? What does it cost you in time, money? What does it cost you in happiness or sleep? I've had patients who have been everywhere and done everything. They've even been told by doctors or neurologists themselves that there's nothing they can do. The greatest joy in my life is seeing those patients a few months down the road and seeing them happy and neuropathy free. That brings me joy. That's why I do what I do. These patients who have been told that there's nothing more they can do, they end up playing what we call Russian roulette with medications. This medication didn't work, we'll try this one. This one's too low, try a higher dosage. They just playing with medications back and forth and back and forth. And again, those medications suppress the entire central nervous system, and they have side effects associated with it. My preference is to try to find the cause of the neuropathy, try to remove that cause, and treat you naturally to help your body restore its natural processes. If you're serious about getting this corrected, please call my office. Ask yourself where you see yourself in 1 to 3 years if your neuropathy is not taken care of. What's going to happen? What is it worth to you to get this under control? The reason I ask is there are some patients who, in spite of my advice, don't do the things I ask them to do. They don't do the exercises. They don't change their diet if that's something they need to do. And then they get frustrated that they're not getting better. I only want people who are going to be committed to this, who are serious in making a difference. If you're serious, if you're committed to making a change, if you're committed to getting this better, my office is for you. Okay? You're going to have to change your diet. You got to meet me halfway, okay? That's why I asked the question, what's it worth to you to improve your condition? Are you serious about getting this handled? If you are, then come to my office. We are for you. You can tell I don't like to mix words. I'm not a salesman. If you like what I have to say, then my office is definitely for you. So what I want to offer to you today for finding this video, for seeking me out, is a reduced price case review. What is a case review? That's where you and I sit down together one-on-one and talk about you. We'll talk about your neuropathy and how it came on. We'll talk about the history of it. We'll do some screening tests, some neurological screening tests, see if we can isolate an area that might be not functioning quite properly. I might take an x-ray. We'll look at blood work that you've had done in the past. We'll look at everything associated with you and your neuropathy to see if you are right for me and if I'm right for you. Only in that case I think we can work well together to get rid of this neuropathy, this stuff that's been bothering you. If that's not the case, we'll send you on your way, or we'll send you somewhere else where we think you'd better fit. So, again, my normal fee is $195. I'm offering it to you for $55. Check the letter that came in with this DVD. There's an expiration date on that. Make sure you call my office before that expiration date to take advantage of this offer. Okay? Call my office, 801-683-9553. Let's get this process started. Let's work together to get you on the road to freedom of neuropathy. I look forward to seeing you and to speaking with you in the future. Thank you very much for watching this video.